Welcome, everyone. This is HLTHPS007, Administer and Monitor Medications. All right, acknowledgement of country. In the spirit of reconciliation, Meditech Training College acknowledges the traditional custodians of country throughout Australia and their connection to land, sea, and community. We pay our respects to their elders, past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people today. All right, the two major objectives of this presentation, elements of this presentation include administer medication within legal parameters, and the fifth element, monitor client's response to administered medication, which we'll go through in more details in the presentation. All right, assist the client in taking their medication and also oversee the client when taking medication and ensure completion of an administration. Observing is using your senses to gain information about the transparent events. As a support worker, you must always be present, when the client takes medication. And these are ways to do it. Watching the client take the medication properly and also complete the medication procedure. And these are steps to prevent medication errors. You need to instruct the client on how to take the medication properly and respectfully. Doing it, oversee them as they go through the medication steps and also observe them in doing the steps. All right, disposal of all used and unused medication and containers. You need to adequately dispose of medication. Inadequate disposal procedure will result to the following, which include negative effects of the medications on the environment, compromising the clients and other people's safety, and also compromising public health. Disposal procedures should be applied to used and unused medication, medication-related containers, contaminated or out-of-date medication, and other unwanted medication and containers. Aside from procedure mentioned, be reminded that you must adhere to your organizational procedure, so all the procedures. By assessing your organization's procedures, you can also find out ways to dispose various pharmaceutical medications. Signs for clients, from clients when necessary medication might be required. Aside from medication with a scheduled dosage, you may also encounter a client that needs a PRN, which is pro-renata medication, which means that the medications are taken as needed. So these medications can be prescribed or over the counter. Next, you need to inform the delegated professional and act accordingly by doing the following steps. You need to obtain instructions from the delegated health practitioner. If the medication is over the counter, confirm with the health practitioner or professional that it is appropriate for the client. Also check the information on the time interval between the doses of the PRN medication. When in doubt over the administered medication, consult with the delegated health professional. Administer PRN medications according to the delegated instructions. Inform the delegated health practitioner that PRN medication has been administered, and if the delegating health practitioner tells you to cease a specific PRN medication, you must comply. All right, record administration of medication. You must always record the administration of medication in writing, either in paper or electronic format. Recording information helps you notify co-workers of any new information related to the client. Documentation requirements are what you need to record information on administering medication. Medication chart is the documentation requirements you typically use in medication administration. It is necessary for errors in medication administration. The reason for Errors in administration of medication usually are failures to enter the right information in the wrong place, um, failure to secure documents from unauthorized people, and potential impacts of this error include violating the rights of medication, the failure to avoid contradictions, substance incapabilities, and um, allergies, difficulty in finding the cause of the medication incident, and difficulty in collaborating with others involved in the administration of medications. Here are the different ways you can record information correctly. You need to use formal language. You need to write illegibly if you're writing. You need to be accurate and concise. You do not include subjective information. Clarify information before putting it into writing. And finally, make sure that you are entering information that is appropriate for the document. All right. Provide accurate information to clients and caregivers on medication administration. The carer is someone who provides formal and unpaid or unpaid support to a client or for the client or family members or friend. Communication of accurate information to clients and carers is essential to prevent medication error and facilitate continuity of care. Side effects and unwanted but expected effects from medication. Unexpected effect of medication can be acute or adverse reaction. Common side effects of medication include itching, fever, nausea, upset stomach, dizziness, drowsiness, and weight gain. The following is a list that shows some tips that you can employ to achieve accurate information accurately. You have a good grasp of the information you need to deliver. You keep a line of communication open with the delegating health professionals. You need to provide information honestly, objectively, and correctly. You need to share your resources with them. Encourage the client and the carers to ask you questions. You need to actively ask the client how they're feeling about the information, and you need to ask the client or carer to share what they have understood about the information you shared. All right, identify and respond to acute or delayed adverse reaction to medication. Monitoring the client's response to the medication involves looking for accurate and delayed adverse reaction. Adverse reaction are unexpected and detrimental reaction to a drug, and this can be life-threatening or cause for hospitalization or extended hospitalization. Basic toxicology, you need to know how to address harmful effects right away. To help you identify this, you need to learn the basic toxicology, which is the study of adverse effects of chemicals to the body's organ. All right, factors include the following. So medication routes are decided based on what the medication needs to target. Sorry, based on what the medication needs to target and the drug's chemical makeup. Also, dosage. Dosage is medications are only safe and effective if they administered the right amount and have therapeutic ranges. The other factors that affect the action of drugs include age, disease processes, nutrition, hydration. Anaphylactic reaction signs include the following. So we have skin reaction, difficulty in talking, swelling of tongue, swelling of throat, clammy skin, difficulty in breathing, tingling sensation, dizziness, wheezing, and confusion or anxiety, which are things that you should be looking out for as they're very, very, very important, or it's very important to act quickly. How to identify acute and adverse reaction. You need to identify these reactions and to monitor the client closely. You need to actively search for these signs and symptoms. And before administering the medication, you should be able to tell them to notify you if they experience any pains or discomfort. Once you identify any signs of acute and adverse reaction, you need to respond within your role responsibility And responding within the limits of your role responsibility includes reporting this to your supervisor or the condition of your client to your supervisor or to the delegating health professional. All right, implement emergency response for acute and adverse reaction. Here are the following steps you need to take to implement emergency response. You need to identify if this is an acute or adverse reaction. You need to contact your delegating health professional immediately. If you cannot contact a delegating health professional, you need to wait. You need to wait for advice from the health professional or other emergency contacts for acute reaction. For adverse reaction in the health setting, you need to call an ambulance on 000, so 000, and you need to document the incident objectively. Record and report response to emergency strategies. The emergency strategy is another term for emergency response. You need to do this since the information will help you anticipate future issues and make necessary prevention um, measures. To record and the response to or to report the response to the emergency strategies would be to write the outcomes of the strategy and why it's needed throughout the incident report, through an incident report. All right, situations where you will need to fill an incident report include medication error, acute and adverse reaction, missing medication, medication refusal, incomplete ingestion, um, inaccurate, incorrect storage of medication. Okay, incident reports are reports that are detailed or reports that detail negative events that happen related to medications. And this might include the following: and emergency strategies implement at the time of the incident, the outcome or response of the client and others to the emergency strategy, the actions taken to prevent the incident from happening again, the follow-up actions needed to avoid any another similar incident from occurring. Here are other tips that you may need to complete an incident report. You need to keep the essential details only. So you need to only write essential details. You need to keep your language formal and you need to write an objective report, not subjective. Um, Identifying signs of clients experiencing pain. Pain is a sensation in the body that is unpleasant and uncomfortable. In the instance involves your nervous system signaling that something is wrong, and these signs include tense and distorted face expressions, tense body parts, within or within, um, restlessness or reduced movement, crying, moaning, groaning, and screaming, less loss of appetite or less appetite, sweating, increased blood pressure, rapid breathing and heart rate, and more, or ECT. All right, observing the client's response to pain relief, you need to um, first of all schedule when to check them to monitor their response to the pain medication. You need to know how the client usually behaves. You need to know how this know what side effects to expect. Um, you need to know the medication may take. You need to know if the medication has taken its effect, and you need to ask if the client if they feel any side effect or if they feel better from the medication being administered. But before doing this, you need to contact your delegating health practitioner to see if he can prescribe a medication for the pain. You need a pain relieving medication designed to alleviate the pain, and this varies according to the intensity of the pain. So you need to be able to describe the symptoms the client is experiencing in order for the doctor to um, advise appropriately and accurately. You can report the client's response by doing the following. You can accurately record information on the client's response to the pain relief. You can identify the delegating health professionals you need to approach. You need to set up a meeting with the delegating health professional. You need to rely on the information you recorded regarding the client's response to the pain relief. You need to make sure you understand the delegating her professional's instruction. You need to ask questions and clarify your understanding. You need to take notes and apply the delegating her professional's instruction. All right. What to do next? You need to complete your e-learning module, chapter 6 and chapter 7, and you need to complete um, the 8th practical task for your next meeting. Thank you, everyone, for listening, and have a lovely day.